My name is Arminda Bisi.
My name is Katie Merrick.
Sundari Birdsall.
Terrence Nat.
Mai Vestergaard.
My name is Shamira Chappelle.
My practicum was at the Farmington Valley Health District. Their office is located in Canton, Connecticut.
I did my practicum at the SHARP Research Lab, and SHARP stands for Systematic Health Action Research Project.
I worked with the SHARP lab, which is part of the University of Connecticut, at Storrs with Blair Johnson.
I did my practicum at the Connecticut Oral Health Initiative, COHI for short, and that's based out of Hartford, Connecticut.
Our practicum was organized between Lawrence and Memorial Hospital in New London, and also between Ledge Light Health District, which is a local public health department that's also located in New London.
I did my practicum experience with UConn Health Disparities Institute. UConn HDI is located in Hartford, Connecticut.
I worked on a data analysis project for music performance anxiety, where I learned how to use our statistical software and recode all of the data and analyze the data. So with this, I also learned how to use different data analytical tools such as Luke, which I was able to interpret the results.
I worked on probably 5 different simultaneous research projects with different people inside of the lab. Some of it was research-based, so data. Some of it was writing-based, so editing manuscripts. And some of it was new creation of content, researching and doing literature review.
My project was a research grant that was funded through the Connecticut Department of Public Health. The practicum project included working to identify substance use and misuse in the New London County on a town level. So basically, over the course of the past 2 semesters, me and my preceptor, Dr. Fawadi Mohammed, have worked to identify data that exists within the New London County regarding substance abuse and basically try to create a database that can highlight across the state and within the county and town levels how substance misuse has affected the county over the past year.
So my practicum was conducting contact tracing with the health department. In the beginning was very hectic as the cases were high, but they trained us to conduct contact tracing, notify school of children that were positive so we can stop the spread of the community, and also contact DPH for any breakthrough vaccination.
I was a dual DMD MPH student, so dental medicine and public health student. And I knew I wanted to do my practicum kind of at the interface of both of those fields and do my work with my mentor during non-business hours. So a lot of it was self-guided research, which then ended up working out perfectly because it was during the summer of 2020. So I had organized it all to be virtual ahead of time and then, ended up with COVID needing to be all virtual anyways.
I had the pleasure of doing my practicum experience while Dr. Wisdom Powell, who was HDI's program director, was completing her APA Division 51 presidential campaign. The overall theme of her campaign was holding space for boys and men of color. So we created a public syllabus surrounding OWN TV's network, David Makes Man TV series, which involved creating a social media campaign and collaborating with faculty members from other institutions.
I think the most rewarding or valuable thing about my practicum was just how many people I got to meet and how much work and the breadth of work that I got to do. I met celebrities in the field of neuroscience and meditation research, and I would never have had the chance to be in the same room with these folks were it not for my treatment as a research assistant, like a legitimate staff member at the SHARP lab.
I think for me, since it was a pretty independent project and what I had looked forward to the most about the practicum was getting to interact with people in the organization and the clientele that they work with and hear stories from. I think meeting with my mentor every week was the best part for me because it was really grounding to connect with her and, felt a little more personal than just doing my work and doing a lot of writing, but getting to bounce ideas off of her.
I believe that this practicum gave me the ability to basically test my research abilities. I never tested myself in this realm of public health work before, so I think this practicum gave me the experience to be able to analyze and highlight data and sort of be able to see how the process goes, working with different healthcare professionals in highlighting different disparities in communities, working to try and highlight data and how that data can be used to analyze different groups and trying to figure out a solution based on what you find. And I think that this practicum overall just gave me a better experience in the public health organizations overall.
I think from my practicum, I learned the skills which I can carry on towards research for my career in the future, which I look forward to use.
The most rewarding aspect of my practicum was seeing how different skills I was learning in the classroom were applicable to real-world professional experiences. And so being able to tie what I was learning into coursework into my practicum experience was extremely valuable.
There were two main things that was very valuable to me. First was being able to help the health department, especially in the beginning, as it was very busy with cases. So it was great to see that I was able to help them out. And the second most rewarding thing was to connect people with the appropriate help. A lot of time when we would call cases, they would ask for help with either food, medication, even a thermometer, and some elderly people needed help around the house. So that was really nice to see that the Farmington Valley Health District had created that help to connect the people in need with the appropriate help. So that was really rewarding.